Mental health has become a focal talking point among experts, caregivers, as well as the general population over the last decade. The Indian government has introduced some key measures over the past few years that have provided glimpses of hope for a robust and inclusive system of care for the ailing mentally ill. However, the on-ground realities concerning access, quality and affordability of mental health services have been abysmal across the country. This is especially so in the case of the poorest and marginalized sections of the society. It was to address this issue that after 15 years of working with the National Health Service in the UK, Dr. Manoj Kumar returned to his home state of Kerala in India. Dr. Manoj Kumar was selected as an Ashoka Fellow by Ashoka, Innovators of the Public, the US-based organization which recognizes innovations in social entrepreneurship. He is also a recipient of the Fellowship of the Royal College of Psychiatrists and the RC Psych Volunteer Psychiatrist Award from the UK. His goal was to create an innovative and effective solution to address the issue of treatment gap in mental health care for the poorest of the poor, including wandering homeless. Thus, Mental Health Action Trust, or MHAT, was born.
The MHAT model is volunteer-led, community-based, and based on the principles of recovery and rehabilitation. The care is delivered in a task-sharing model, which means that the costs are significantly reduced. The care is delivered in partnership with community service organizations such as palliative care groups. Because care is delivered in settings where other medical care is also delivered, the stigmatizing effect is kept low.
Task sharing involves redefining the dynamics of psychiatric care by delegating some of the tasks to professionals with less training as well as to mental health workers. These non-expert professionals are then offered training, support and supervision on a continuous basis as they engage in the delivery of care. This model is cost-effective because it is decentralized, which means large numbers of local partners and thousands of volunteers engage in the running of the program at the community level. Cutting-edge technology involving databases, apps and video conferencing tools are used to enhance efficiency and reach. MHAT has also impacted tribal communities by building trusted networks of individuals within the community to help them overcome stigma and to avail the services.
In tribal colony, the major challenges we faced was that the patient won't come to the clinic directly. So we visited the colony and made a support system in the colony with the help of Anganwadi teachers, tribal promoters or from the family members or sometimes from the neighbors and they provide care and support to the patients.
Since its inception, large numbers of patients and families have benefited from the MHAT model thanks to the volunteers, partner organizations and technology.
The MHAT model is driven by a hope-giving belief that recovery is possible. We define recovery as a journey towards a meaningful life that includes meaningful work, friends and social connections, a decent place to live. This journey can only be achieved if professionals and patients, families and communities work collaboratively, facing problems and finding solutions together, celebrating successes as they are achieved.
MHAT's contribution in the field of community psychiatry has been acknowledged both within India and internationally. Meanwhile, the growing importance of fostering community ownership in mental health care continues to be evident in various reports. To meet this demand, MHAT has embarked on several initiatives to help the poorest of the poor in obtaining access to high-quality, recovery-oriented mental health care as well as to bridge the treatment gap.
MHAT has been able to support the vulnerable population thanks to kind contributions from individuals and organizations such as yourself. For this, we are immensely grateful. Going forward, MHAT aims to fill the gaps in mental health literacy as well as access of services by using technology and innovation. For this, we continue to need your support. Here are some of the ways in which you can support MHAT. Please visit the MHAT website www.mhatkerala.org and make a contribution. You can also register for a course of interest for yourself or your organization. You may also consider partnering with MHAT to avail psychotherapy and counseling services for yourself, your team, or your communities.
Join us. Together, let us rebuild lives.